We begin with breaking news about the coronavirus. Here in the U.S., at least 33 states and the District of Columbia have confirmed over 500 cases and more than 20 deaths. 100 countries are now reporting cases, and Italy, one of the hardest hit, has placed millions on lockdown. Now, one of the nation's top outbreak experts says something similar could happen here. We also learned there's a quarantine plan for the thousands of passengers and crew who've been stuck on a cruise ship off the coast of California. The State Department also advising Americans, especially those with underlying medical conditions, to stay off cruise ships. Our Steve Patterson has the very latest.
Tonight, after nearly a week adrift, in isolation and without answers, finally an end in sight.
Agreement has been reached to bring our ship into the port of Oakland.
The Grand Princess is expected to dock Monday. Already 21 people are positive for coronavirus, including 19 crew members, thousands still untested. Tomorrow in Oakland, California, those passengers will be transferred to 4 military bases, 2 in California, 1 in Texas, and 1 in Georgia, where they will be screened, tested, and quarantined for 2 weeks. Passengers say it's been miserable.
It's kind of like being in a little prison cell at sea.
Oh, we are not allowed out of our room at all.
For Gina Pilata and Mike Nicky, being trapped on board is a matter of life or death.
My husband is actually, as of today, running out of his diabetic medications.
In Oakland, worry from residents as news spreads that the ship is coming in.
It's going to just have the whole Bay Area scrambling at this point. That's going to wake everybody up. I think it's going to be a tough situation.
Off the coast of South Florida, another cruise liner stuck at sea while officials test 2 crew members, and another in Egypt quarantined with Americans on board. Today, a member of President Trump's coronavirus task force with this urgent warning.
If you're a person with an underlying condition, and you are particularly an elderly person with an underlying condition, you need to think twice about getting on a plane on a long trip. And not only think twice, just don't get on a cruise ship.
Meanwhile, near Seattle, at the heart of the nation's coronavirus outbreak, more deaths announced today. A wake-up call for the community now even more cautious. Church this morning was from a distance.
We're not touching each other. We've changed some of our basic practices around communion and greeting each other.
Steve Patterson is at the Port of Oakland. Steve, is it just the passengers getting off that ship tomorrow?
Well, Jose, the answer to that is yes, but officials say that crew of 1,100 will remain quarantined on board this ship and treated as necessary. And as soon as those passengers disembark, that ship leaves the bay. Jose?
Steve Patterson in Oakland, thank you very much. And in Italy tonight, 16 million people are under a lockdown in the region known as the country's financial hub. NBC's Bill Neely is in Rome with the very latest.
The drastic lockdown sent thousands rushing for trains out of Milan. 16 million people are now quarantined, a quarter of Italy's population. No one can leave or enter. Hospitals are being overwhelmed by the virus, said the Prime Minister. It's an emergency. Milan today looked deserted. Italy now the worst hit country in the world. 133 new deaths in just one day, 366 now in all. And today, more than 1,400 new infections. Venice, too, is now locked down and deserted today. Pope Francis said prayers by video link to deter crowds at the Vatican. But he still appeared briefly at a window. The Vatican's museums and its Sistine Chapel now closed, like museums across Italy. It is a growing crisis here in Italy and in the US, but globally, more people have now recovered from the virus than are ill with it. China today closed one temporary hospital, all patients discharged. The rate of new cases and deaths falling fast. But in Egypt, 24 Americans are the latest quarantined on a cruise ship. This one trapped on the Nile. At least one American has tested positive. The rest scared.
It's an overwhelming feeling of being helpless. We have no control over anything.
Italy's new rules will be tested tomorrow as millions begin a new work week. Its richest region now closed for a month. Bill Neely, NBC News, Rome.
And in Washington State tonight, we learned those new deaths were tied to a nursing home. Many have already died from the virus. The state's healthcare system is under immense strain, and there's concern that other states could soon face the same challenges. Here's Kathy Park.
Tonight, growing frustration in Seattle at the nursing home now linked to 16 coronavirus deaths. The facility where residents are at heightened risk saying they need more help. Kathy Jackson believes she may have been exposed to the coronavirus at the Life Care Center at Kirkland. The 71-year-old self-quarantined after noticing symptoms. But more than a week later, she's still waiting for her results.
I was not ready for being hung up on. I was not ready for the runaround that I've been getting.
She says the path to getting tested was the hardest part. Call after call to the local health department turned into a chase for answers, delaying her diagnosis.
The problem is that they were totally caught off guard.
Epidemiologist and virologist Joseph Fair, PhD, MPH, says across the country, the demand on healthcare providers is surging.
We're going to see a complete overwhelming of the entire medical system for the United States.
If you're showing symptoms possibly linked to the virus, Fair suggests not going to the emergency room.
If you go to an ER, you are by nature exposing everyone else to COVID-19 who might be there.
If you're feeling sick, health officials say first call your doctor, who can then alert the health department if they believe you're at high risk.
My guidance is this: if you're feeling ill or if you're in that high risk category, avoid as much contact as you can with others.
Now, Kathy, what does the King County Public Health Department say about the Jackson case and others potentially exposed?
Yeah, they didn't actually address her case specifically, but did say that they are working around the clock and providing guidance to thousands of people who are reaching out now. They're calling this an unprecedented and challenging situation.
Kathy Park, thank you very much. There's a lot of fear and confusion about the coronavirus. Here's what we know tonight. There are more than 20 deaths in the United States. There is no vaccine and a delay getting those test kits. It's especially dangerous for the elderly and conditions. And while President Trump is trying to reassure Americans, other officials are taking a more urgent tone. Hans Nichols explains.
Tonight, mixed messages on the threat of coronavirus, with one of the most public faces of President Trump's task force warning that the most difficult days may be ahead.
Clearly, I'm concerned about community spread. You have to realistically be concerned about community spread.
But the Surgeon General painting a more optimistic picture.
And so we actually feel pretty good that some parts of the country have contained.
You know, you don't want to alarm people, but given the spread we've seen, anything is possible. And that's the reason why we've got to be prepared to take whatever action is appropriate to contain and mitigate the outbreak.
Adding to the confusion, Dr. Ben Carson claiming that the administration has a plan for tomorrow's arrival of the Grand Princess.
The plan will be in place by that time.
Before acknowledging that the plan hasn't been finalized.
We shouldn't have 16 people saying what the plan is.
Okay,
particularly when it hasn't been fully formulated.
And President Trump taking to Twitter that he has a perfectly coordinated and fine-tuned plan for our attack on coronavirus. And last night, the president saying he was not worried about the virus coming to the White House.
No, I'm not concerned at all. No, I'm not. No, we've done a great job.
But blasting the New York Times as an embarrassment to journalism after it published a story that described internal White House debates on how to confront the virus, with the Surgeon General acknowledging the challenge of accurately informing the public.
And the messaging, quite frankly, is hard.
Hans Nichols joins us now. Hans, any concern that the president may have been in direct proximity to someone who has contracted coronavirus?
Well, both the president and the vice president spoke at a conference last week where one attendee has since tested positive, but the White House says there's no indication that either met with or was in close proximity to that affected individual.
Tonight, many concerned about coronavirus are wondering how to stay safe when they fly. Here's NBC's Sam Brock.
To fly or not to fly, with cases of coronavirus spreading worldwide, travelers are on edge and doing everything they can to stay safe in the skies.
I'm really worried about just being in the airport because we get people from all over and you never know who you're coming in contact with directly.
Do you feel safer wearing the mask?
I do.
But are masks effective? The CDC says they should be considered for sick travelers with respiratory symptoms like coughing and sneezing, and for passengers sitting near others with respiratory symptoms. While a lot of flights to affected areas have been canceled, for anyone who does decide to travel, doctors say precautions on planes are key.
It's safe to get on a plane, but use your hand hygiene. Try to avoid people who are coughing and sneezing.
But if you're older, if you have underlying illnesses, you have to ask yourself, is this really an essential trip?
But what else can you do? In a perfect world, you'd be sitting next to the window because obviously your exposure here is the least. If you sit in the middle seat, this is the worst because you have people on both sides of you. In fact, no matter where you're seated, the CDC says people who are within 6 feet of a traveler with coronavirus are at medium risk of getting the disease. And what about what you're breathing on board? According to the International Air Transport Association, there's filters on planes that actually get out about 99.9% of airborne microbes, which means the air quality on the cabin here is actually as good or better than your office. Also, before takeoff, pay special attention to cleaning surfaces, any place other passengers have touched, including armrests, those metal seat buckles, plus the front and backs of tray tables and digital screens on the seat backs. Finally, use a tissue or wipe on the handle opening the bathroom doors, flushing the toilet, and turning the water on and off in the sink. Small tips that could make a big difference for a healthier time in the skies. Sam Brock, NBC News.